Welcome all. Today, we are focusing on a finding in obstetric ultrasound you really need to understand. Echogenic fetal bowel. Let me break it down for you. When you're scanning, sometimes the fetus's bowel shows up much brighter on the image than you'd expect. To call something echogenic bowel, don't just eyeball it. Compare its brightness to the fetal bone, like the femur or spine. But here is the catch. Always set your gain so you are not blowing out the image. Turn off tissue harmonic imaging and compound imaging, as these modes can make the bowel look artificially bright and fool you. If you're unsure, take it slow. Lower your gain step by step and see which structure fades first, the bowel or the bone. That's a solid trick for getting reliable scans. I also want you to be familiar with the grading system. Grade 0 is when the bowel is about the same as the liver. No big deal. Grade 1 is a little brighter than the liver, but not at the bone level. Grade 2 means it has the same brightness as bone. Now you pay more attention. And Grade 3 is when the bowel is even brighter than bone, which is uncommon. Think of these grades as a structured way to communicate exactly what you see. Whenever you see echogenic fetal bowel, stop and think. What could it mean? Most of the time, especially if it's an isolated finding, the outcomes are good. About 3 out of 4 babies are born perfectly healthy. That said, you should always check for other findings like soft markers or growth issues. The main flags include potential associations with Down syndrome, certain infections like the torch group, cystic fibrosis, or bowel blockages. Your role is to spot if it's showing up alone or with other concerns and raise the right level of alert. Using high-frequency probes, like 8 MHz or higher, can make everything look brighter, tricking you into a false positive. Also, in the third trimester, normal meconium buildup can make the bowel look shiny. Don't let that throw you. Always trust your method over a gut feeling. Double-check your settings, consult a senior, and document how you set your images. My final advice: approach each case methodically. Use your grading system and imaging tricks, and collaborate closely with radiologists and the OB team. Every scan is a teaching moment. See you in the next lesson.